everyone.
Michelle.
Good evening, everyone, and thank you for
there you go.
joining us. Good evening. I'm Julie Byerly, and I have the honor of serving as the president of Geisinger College of Health Sciences and the chief academic officer of the Geisinger system. And we are so happy to welcome you tonight to Geisinger Commonwealth School of Medicine. Thank you for joining us. Since our founding in 2008, our medical school has focused on improving the health and well-being of northeastern Pennsylvania. We do that in many, many ways. One of the most important ways is that we produce a health profession workforce to serve our region. We have graduated nearly 1,200 physicians in 13 graduating classes, more than 100 of our alums, and about 150 of our current they finished their training. This added to the more than 100 doctors who already work in our system as attendings or residents, in addition to the alumni working in our region outside of Geisinger, means that we are really fulfilling our founder's vision of transforming the healthcare workforce up here in northeastern and central Pennsylvania. But that is not all. We have expanded the health professions we're educating as we have become Geisinger College of Health Sciences, now with nursing education, master's degrees, and genetic counseling training, in addition to an impressive research portfolio and more than 700 residents in training across the system. Producing a workforce is essential, but it's not enough. From day one, our students, staff, and faculty have reached into the communities that we serve with service learning and community engagement activities. We also now have a monthly community education series open to the public to boost health awareness and education for all our neighbors. And tonight you are here at our October session of our community engagement education series. Welcome. Tonight's session is special. It builds upon the work established by one of our school's founders, Dr. Bob Naismith. Dr. Naismith is a champion for our school, our community, and for health and well-being, especially around prevention, which we're focusing on tonight. This preventive medicine series, now tonight with its 13th session in the series, is part of his lasting impact. Dr. Naismith is also leading the volunteer work to raise philanthropic support for our school's first ever endowed professorship at the college. He is championing an endowed professorship in community health and nutritional medicine, and we are grateful for his leadership. Dr. Naismith, please come forward with a few remarks about your work.
Thank you, Dr. Dean Byerly, and thank you all for being here this evening. What makes this preventive medicine lecture series so important is that it shines a light on prevention as a powerful tool. Nearly 70% of chronic conditions are preventable through lifestyle changes, yet most of the healthcare spending is directed in treating illnesses and rather than avoiding it. This series is not just an academic exercise, it's a way to create a culture of health that reaches beyond our classrooms and clinics. Each lecture equips our learners, clinicians, and community leaders with practical evidence-based tools to improve healthcare and prevent disease. Tonight's event is also part of a larger vision. The School of Medicine is working to establish a chair in community health and nutritional medicine, a position that will ensure that nutrition, prevention, and lifestyle medicine are fully integrated into medical education, research, and clinical practice. This is how we'll build a legacy of a healthier future, not only for our patients, for generations to come. So as we listen to tonight's speaker, let's keep in mind that prevention is not just avoiding illness, it's about creating stronger families and healthier environments and healthier communities. Together, through education and innovation, we can prove that prevention truly can change lives. So, thank you. I can't steal that.
Thank you, Dr. Naismith. Before I introduce our speaker, I'd like to call your attention to our brochures on this Preventive Medicine Lecture Series that are available in the lobby and that many of you might have picked up on the way in. There is a little bit of information about the series. There's a highlight about the bio of Dr. Greger. And I just simply wanted to point out there is a donate here barcode to make it very easy for you to participate in this effort should you choose to. Also on the back, there are a list of our past lecturers in this series, and all of these recordings are available online on our webpage. So if you missed one, feel free to seek that education that way. So now it is my distinct honor to introduce tonight's speaker, Dr. Michael Greger, a physician, an internationally recognized public health expert, and a New York Times best-selling author whose work has transformed how we think about nutrition and preventive medicine. Dr. Greger is the founder of nutritionfacts.org, a nonprofit platform that provides free evidence-based information on the latest in nutrition research. He is a graduate of Cornell University and Tufts University School of Medicine and a founding member and fellow of the American College of Lifestyle Medicine. His books, including How Not to Die, How Not to Diet, and How Not to Age, have inspired millions to take charge of their health through informed dietary and lifestyle choices. Tonight, as part of our Preventive Medicine Lecture Series, Dr. Greger will share insights from his groundbreaking research and others' groundbreaking research on how simple changes in what we eat can help prevent, treat, and even reverse some of the leading causes of death in the United States. Please join me in welcoming Dr. Greger.
Hello, hello. Can you hear me? The cheap seats in the back there. Hello, hello. Good, excellent. I am honored to be lucky speaker number 13. If you look at that list, I'm quite honored to be part of that pantheon, and do encourage you to go back and watch those lectures. In fact, I want to as well. That looks like a fantastic resource that you've given to the community. And so, too bad more medical schools out there weren't doing the same thing. You heard this term that you may be unfamiliar with, nutritional medicine? What does that even mean? Well, that's what I'll touch on this evening. Allow me to begin on a personal note. This is a picture of me taken around the time that my grandmother was diagnosed with end-stage heart disease and sent home to die. Sure, I did so many bypass operations, basically get so scarred up inside that there's nothing more they could do. Confined in a wheelchair, crushing chest pain, her life was over at age 65. But then she heard about this guy, Nathan Pritikin, one of our early lifestyle medicine pioneers. And what happened next is actually chronicled in Pritikin's biography. My grandma was one of the death's door people. Frances Greger, my grandmother, arrived in a wheelchair. Mrs. Greger had heart disease, angina, claudication. Her condition is so bad she could no longer walk without great pain in her chest and legs. Within 3 weeks, though, she was not only out of her wheelchair, she was walking 10 miles a day. This is my grandma at her grandson's wedding, 15 years after doctors had abandoned her to die. She was given a medical death sentence at age 65, but thanks to a healthy diet, was able to enjoy another 31 years on this planet until age 96 to continue to enjoy her 6 grandkids, including me. That's why I went into medicine. When Dr. Dean Ornish published his lifestyle heart trial years later, proving with something called quantitative angiography that indeed coronary artery disease could be reversed in the majority of patients without drugs or surgery, just a plant-based diet and other healthy lifestyle behaviors, I assumed this was going to be the game changer. I mean, my family had seen it with their own eyes, but here it was, in black and white, published in one of the most prestigious medical journals in the world, yet nothing happened. So wait a second. If effectively the cure to our number one killer could get lost down some rabbit hole and ignored, what else might there be in the medical literature that could help my patients, but just didn't have a corporate budget driving its promotion? Well, I made it my life's mission to find out. For those of you unfamiliar with my work, every year I read through every issue of every English language nutrition journal in the world, so busy folks like you don't have to. I then compile the most interesting, most groundbreaking, most practical findings and new videos and articles I upload nearly every day to my nonprofit site, nutritionfacts.org. Everything on the website is free. There are no ads, no corporate sponsorships, strictly non-commercial, not selling anything. Just put it up as a public service, as a labor of love, as a tribute to my grandmother. All proceeds I receive from the sales of all my books are donated directly to charity. All honoraria I get from speaking engagements, all donated directly to charity. I just want to do for everyone's family what Pritikin did for my family. New videos and articles every day on the latest in evidence-based nutrition. What a concept. Okay, so where did Pritikin get his evidence from? Well, a network of missionary hospitals set up throughout sub-Saharan Africa uncovered what may be one of the most important advances in health. The fact that many of our major and commonest diseases here in the Western world were universally rare, right? Like heart disease. In the African population of Uganda, for example, coronary artery disease was almost non-existent. You say, oh, wait a second. Our number one killer, almost non-existent? What were they eating? Well, lots of vegetables and grains and greens, and their protein almost entirely from plant sources. And they had the cholesterol levels to prove it, similar to what one sees in kind of modern day plant eaters. So wait a second, maybe the Africans were just dying early from some other disease, never lived long enough to get heart disease. No, here's age-matched heart attack rates in Uganda versus St. Louis. Out of 632 autopsies in Uganda, 1 myocardial infarction. Out of 632 age and gender matched autopsies in Missouri, same age and gender distribution, 136 myocardial infarctions, more than 100 times the rate of our leading killer. In fact, they were so blown away, went back to another 800 autopsies in Uganda, and still, there was just that one small healed infarct, meaning it wasn't even the cause of death, out of 1,427 patients, less than 1 in 1,000. Whereas here, heart disease is an epidemic. Atherosclerosis, hardening the arteries, is a disease that begins in childhood. By age 10, the arteries of nearly all kids raised on the standard American diet already have what are called fatty streaks building up inside of their arteries, the first stage of the disease. Then the plaques start forming in their 20s, can get worse in their 30s, and then can start killing us off. in our heart. It's called a heart attack. In our brain, the same disease process can cause a stroke. So if there's anyone here this evening older than age 10, then the question isn't whether or not we should start eating healthy to prevent heart disease. It's whether or not you want to reverse the heart disease you likely already have, whether you know it or not. But is that even possible? Researchers took people with heart disease and put them on this kind of plant-based diet, followed by populations that do not get epidemic heart disease. Their hope was maybe we could slow the disease down, maybe even stop it. But instead, something miraculous happened. The disease started to reverse, to get better. As soon as people stopped eating artery-clogging diets, their bodies were able to start dissolving some of that plaque away, opening up arteries without drugs, without surgery, suggesting their bodies wanted to be healthy all along, but were just never given the chance. The improvement in blood flow in the heart muscle itself, here on the left, was after just 3 weeks of plant-based nutrition. Let me share with you what's been called the best-kept secret in all of medicine. Best-kept secret in medicine is that sometimes, under the right conditions, the body can actually heal itself. If you whack your shin really hard on a coffee table, right, and get all red, hot, painful, swollen, inflamed, but will heal naturally if you just stand back and let your body work its magic. All right, but what if you whack your shin coffee table every single day? In fact, 3 times a day, breakfast, lunch, and dinner. Right? You'd never heal. You go to your doctor and be like, my shin hurts. They'd be like, no problem. Whip out their pad, write a prescription for painkillers. You're still whacking your shin 3 times a day. Still really hurts like heck, but feels so much better with those pain pills on board. Thank heavens for modern medicine. It's like when people take, nitroglycerin for crushing chest pain, right? Tremendous relief, but doesn't actually treat the underlying cause of the disease. Our body wants to come back to health if we let it. Right? But if we keep re-injuring ourselves, if we keep stabbing ourselves with a fork 3 times a day, we may never heal. It's like smoking. One of the most amazing things I learned in all of my medical training was that within about 15 years of stopping smoking, your lung cancer risk approaches that of a lifelong non-smoker. Isn't that amazing? Your lungs can clear out all that tar, and eventually it's almost as if you never started smoking at all. And every morning of our smoking life, that healing process starts until, wham, first cigarette of the day. Re-injuring our lungs with every puff, just like we can re-injure our arteries with every bite, when all we had to do all along, the miracle cure, is just stop re-damaging ourselves, right, and let our natural healing processes bring us back towards health. Sure, we can choose moderation, hit ourselves with a smaller hammer, but why beat yourself up at all? We've known about this for decades. American Heart Journal, 1977. Cases like Mr. F.W. here. Heart disease so bad, couldn't even make it to the mailbox. Started eating healthier. A few months later, he was climbing mountains, no pain. All right, that's good. Now, there are these fancy new classes of anti-angina drugs on the market, certainly. May cost thousands of dollars a year. But hey, at the highest dose, may be able to extend exercise duration as long as 33.5 seconds. It doesn't look like those choosing the drug route are going to be climbing mountains anytime soon. Right? See, so plant-based diets aren't just safer and cheaper, but can work better because you're treating the underlying cause of the disease. Now, normally at this point, I move on to killer number 2 and talk about the role diet may play in preventing and arresting or reversing each of our top 15 killers. But I want to save lots of time for questions. And in a certain sense, it's like, well, what more do we need to know? Right? There's only one diet that's ever been proven to reverse the progression of heart disease in the majority of patients, a plant-based diet. All right, like, so any time someone tries to sell you on some new diet, do me a favor. Just ask them, wait a second, has this diet been proven to reverse heart disease? You know, the number one reason me and all my loved ones will die? Right? If the answer is no, why would you even consider it? Like, if that's all plant-based diet could do, reverse the number one killer of men and women, shouldn't that kind of be the default diet until proven otherwise? And in fact, that can also be so effective in preventing, arresting, and reversing other leading killers like type 2 diabetes and high blood pressure, which seem to make the case for plant-based eating simply overwhelming at this point. And let me touch on those other two conditions. Type 2 diabetes, for example, which we can prevent, arrest, and reverse with a plant-based diet, something we've known since back in the 1930s, where a group of diabetics were placed on a type of plant-based diet. Within 5 years, a quarter of them were able to get off insulin. But plant-based diets tend to be relatively low-calorie diets. I mean, maybe their diabetes just got better because they lost so much weight, right? I mean, to tease that out, what you'd have to do is put people on a healthy diet, but force them to eat so much food that they didn't lose any weight. Then we could see if there's some, there's some special, unique benefits to plant-based eating beyond just all the easy weight loss. Well, we'd have to wait 44 years, but here it is. Subjects were weighed every day. They started to lose weight. They were made to eat more food. In fact, so much more food that some of the participants have problems eating it all. They're like, oh, not another salad. Ugh. But eventually they adapted. So, no weight loss despite restricting meat, eggs, dairy, and junk. Okay, so with zero weight loss, was there any benefit to plant-based eating? Well, overall insulin requirements dropped 60%. Half were able to get off insulin altogether, despite no change in weight. Wow, how many years did that take? No, 16 days. 16 days later. So we are talking about people who had diabetes for 20 years, injecting 20 units of insulin a day, and then 13 days later on none. Diabetes for 20 years, then off all insulin in less than 2 weeks. Diabetes for 20 years because no one had told them about a plant-based diet. Okay? For 2 decades, they were 13 days away at any time from being free. Here's patient number 15, 32 units of insulin on the control diet, and then 17 days later on none. Lower blood sugars on 32 units less insulin with no weight loss. That's the power of plants. And as a bonus, their cholesterol dropped like a rock to under 150 on average in 16 days. So just like moderate changes in diet may only net you moderate reductions in cholesterol, how moderate do you want your diabetes? Everything in moderation may be a truer statement than many people realize. Asking our patients to make moderate changes in lifestyle can leave them with moderate blindness, moderate kidney failure, moderate amputation, maybe just a few toes or something. Moderation in all things isn't necessarily a good thing. There was a famous study published in a journal called Cell Metabolism that purported to show that diets high in meat, eggs, and dairy could be harmful to health as smoking, supposedly suggesting that those under age 65 who eat lots of animal protein 4 times as likely to die from cancer or diabetes. But if you look at the actual study, you'll see that's simply not true. Those eating lots of animal protein in middle age shouldn't have 4 times the risk of dying from diabetes. They had 73 times the risk of dying from diabetes. Now, those that chose moderation, only a moderate amount of animal protein, they just had 23 times the risk of death from diabetes. The academic institution where the study was done sent out a press release with a memorable opening line: "That chicken wing you're eating could be as deadly as a cigarette, explaining how, look, diets rich in animal proteins may quadruple one's risk of dying from cancer, which is kind of comparable to what might get smoking cigarettes. But so what was the response in the academic community to this revelation that diets high in meat, eggs, and dairy could be harmful to health as smoking? Well, one nutrition scientist said it was potentially dangerous to tell people about this study, right? A smoker might think, hey, why bother quitting smoking? My ham and cheese sandwich is bad. It's just as bad for me. So, shh, let's not. That reminds me of a famous Philip Morris cigarette ad that tried to downplay the risk by saying, hey, you think secondhand smoke is bad, increasing your risk of lung cancer 19%. Why? Drinking 1 or 2 glasses of milk every day may increase your risk maybe 3 times bad, 62% increased risk of lung cancer, right? Or doubling your risk frequently cooking with oil, tripling your risk of heart disease by eating non-vegetarian, or multiplying your risk 6-fold if you eat lots of meat and dairy. So, they concluded, let's keep some perspective here. The risk of lung cancer for secondhand smoke may be well below that of other everyday activities, so breathe deep. Right? That's like saying, don't worry about getting stabbed, because getting shot, so much worse. How about neither, right? The 2 risks don't make a right. Of course, you'll note Philip Morris stopped throwing dairy under the bus once they purchased Kraft Foods. Just saying. High blood pressure, killer number 13. Nearly 76 million Americans affected. That's 1 in 3 adults. As we age, our pressures get higher and higher, such that by age 60, most of us have high blood pressure. Wait a second. In fact, most of it, as we get older, maybe it's less a disease and more just a natural, inevitable consequence of aging. No, we've known since the 1920s that high blood pressure need not occur. Researchers took blood pressures for 1,000 people living in rural Kenya. Typical Kenyan diet centered around whole plant foods, corn, bean, vegetables, fruit, greens. Our pressures go up as we age, such that where most of us are actually hypertensive as we get older, their pressures go down with age. And the lower the better, right? This whole 140/90 cutoff is arbitrary, now down to 135. Even people who start out under 120/80 appear to benefit from blood pressure reduction, right? If you went to your doctor with blood pressure 120/80, they'd give you a gold star. But the ideal blood pressure, the no benefit from reducing it further blood pressure, maybe 110/70. Is it even possible to get blood pressures that low? It's not just possible, it's normal for those living healthy enough lives. Over 2 years at this rural Kenyan hospital, 1,800 patients were admitted. How many cases of high blood pressure did they find? 0. Wow, they must have had low rates of heart disease, right? They had no rates of heart disease. Not a single case of arteriosclerosis, our number 1 killer, was found. Rural China. Same thing, about 110/70 their entire lives, 70-year-olds, with the same blood pressure as 16-year-olds, right? Now, Africa, China, vastly different diets. What they shared in common is that they were plant-based day-to-day, with meat only eaten on special occasions. Yeah, okay, but why do we think it's the plant-based nature of their diets that was so protective? Because in the Western world, the only dietary group that gets it down that low, on average, were those eating strictly vegetarian diets, coming in at a perfect 110/65. This is the largest study of plant-based diets to date. This is 89,000 Californians in the Adventist II study, comparing non-vegetarians to so-called semi-vegetarians, those who don't eat meat on a daily basis, more on a weekly basis, compared to those who don't eat any meat except fish, compared to those who don't eat any meat at all, compared to those who eat no meat, eggs, or dairy, right? Now, this was an Adventist study, so this is a really healthy cohort of meat eaters. Tended not to smoke, to exercise, eat lots of fruits and vegetables, actually didn't eat a lot of meat compared to the general population, yet there still appeared to be this stepwise drop in high blood pressure rates the more and more plant-based people ate. Same thing with diabetes. Same thing with obesity, right? Yes, we could throw the majority of our risk out the window eating strictly plant-based, but it's not all or nothing. It's not black or white. Any movement we can make along this spectrum towards eating healthier can accrue significant benefits. Right? We can show this experimentally. You take vegetarians, you give them meat, pay them enough to eat it, and their blood pressures go up. Or you take people who already eat meat, remove meat from the diet, and their blood pressures go down within 7 days. And this is after the vast majority had to stop their blood pressure medications or reduce their blood pressure medications. They had to. I mean, once you eliminate the underlying disease, you can't be on blood pressure pills, normal blood pressure, your dropping pressure is too low, get dizzy, fall over, hurt yourself, right? So your doctor has to pull you off the pills. Lower pressures on fewer drugs. In 7 days, that's the power of plants. So, does the American Heart Association recommend a no-meat diet? No, they recommend this low-meat diet, so-called DASH diet. You say, well, wait a second. Well, why not completely plant-based? When the DASH diet was being created, were they just not aware of this landmark research done by Harvard's Frank Sachs? No, they were aware. The chair of the design committee that came up with the DASH diet was Frank Sachs. See, the DASH diet was explicitly designed with the number one goal of capturing the blood pressure lowering benefits of more plant-based diets, yet contain enough animal products to make it palatable to the general population, right? He didn't think the public could handle the truth. Now, you can see what they were thinking, right? Just like drugs never work unless you actually take them, diets never work at all unless you actually eat them. So they're thinking, look, you know, how many people are going to go strictly plant-based? All right, if we soft pedal the message, come up with some kind of compromise diet, well then look, on a population scale, we'll do more good. Okay. Tell that to the 1,000 American families a day whose loved ones die because of high blood pressure. Maybe it's time to start telling the American public the truth, which is that in the United States of America, most deaths are preventable and related to nutrition. According to the Global Burden of Disease Study, the most rigorous analysis of risk factors for death and disability in history, the number one cause of death in these United States is the American diet. Also a leading cause of disability, right? Diet has bumped tobacco smoking to number 2. Cigarettes now only kill about 500,000 Americans every year, whereas our diet kills many more. Okay, well, if most deaths in the United States are preventable and related to nutrition, well, then, I mean, obviously, nutrition is the number one thing taught in medical schools, right? The dean isn't nodding. I'm not sure exactly why. Well, obviously, it's the number one. It's the number one thing your doctor talks to you about at every single visit, right? Obviously, right? How is there this disconnect between what the science is showing us and the mainstream practice of medicine? Well, let's do a little thought experiment. Imagine yourself a smoker back in the 1950s. Back in the 50s, the average per capita cigarette consumption was about 4,000 cigarettes a year, meaning the average person walking around smoked half pack a day, on average. The media was telling people to smoke. Famous athletes agreed. Even Santa Claus wanted you to smoke. I mean, look, you want to keep fit, right? Stay slender, so you make sure to smoke and eat hot dogs to stay trim, and lots of sugar to stay slim and trim, right? A lot better than that apple there. I mean, sheesh, right? Though apples do connote goodness and freshness, wrote an internal tobacco industry memo, which brings up many possibilities for a youth-oriented cigarette. They want to make apple-flavored cigarettes for kids. Shameless, right? For digestion's sake, you should smoke. I mean, no curative powers claimed for Philip Morris, but hey, better be safe than sorry, and smoke. Blow in her face and she'll follow you anywhere. No woman ever says no. They're so round, so firm, so fully packed. After all, John Wayne smoked until he got lung cancer and died. Back then, even the paleo folks were smoking. And so were the doctors. Now, this is not to say there wasn't controversy within the medical profession. Sure, some doctors smoked Camels. Others preferred Lucky's. There was a little disagreement there. The leader of the U.S. Senate agreed. I mean, who wouldn't want to give their throat a vacation? Not a single case of throat irritation. How could there be when cigarettes are just as pure as the water you drink? Don't worry. If your throat does get a little irritated, no problem. Your doctor can always write you a prescription for cigarettes. This is in the Journal of the American Medical Association. Right? So when mainstream medicine is saying that smoking on balance is good for you, not just neutral, but actually good for you, when the American Medical Association is saying that, where could you turn back then if you just wanted the facts? What's the new data advanced by science? Well, she was too tired for fun. And then she smoked a Camel. Babe Ruth spoke of proof positive medical science, that is, when he still could speak before he died of throat cancer. Now, if by some miracle back then there was some kind of smokingfacts.org website that could deliver the science directly, bypassing commercially corruptible institutional filters, you would have become aware of studies like this. This is an Adventist study out of California published in 1958, showed that non-smokers had at least 90% less lung cancer than smokers. Right? This wasn't the first one. Famed surgeon Michael DeBakey was asked why his studies back in the 30s linking lung cancer and smoking were simply ignored off the face of the earth. He had to remind people what it was like back then. We were a smoking society, right? It was on airplanes. It was on, medical meetings were one heavy haze of smoke. Smoking was, in a word, normal. So, back to our thought experiment. You're a smoker in the 50s, in the know. What do? I mean, with access to the science, you realize that the best available balance of evidence suggests your smoking habit, not so good for you. So, do you change or do you wait? If you wait until your doctor tells you between puffs to quit, it could be too late. Right? If you wait until the powers that be officially recognize it, like the Surgeon General did in the subsequent decade, you could be dead by then. It took 25 years for the Surgeon General's report to come out. It took more than 7,000 studies in the deaths of countless smokers before the first Surgeon General's report against smoking came out. You'd think maybe after the first 6,000 studies could give people a little heads up or something. All right? Maybe we should have stopped smoking after the 700th study like this came out. Right? As a smoker in the 50s, on one hand you had all of society, the government, the medical profession itself telling you to smoke. And on the other hand, all you had was the science. If you're even aware of studies like this, right? Now, fast forward 55 years, there's a new Adventist study out of California warning Americans about something else they may be putting into their mouths. And of course, it's not just one study. Put all the studies together. Mortality from all causes put together, including many of our dreaded diseases, significantly lower among those eating more plant-based. So, instead of a smoker in the 50s going along, imagine you or someone you know going along with America's eating habits today. Well, what do? I mean, with access to the science, realize the best available balance of evidence suggests your eating habit, not so great. What do? Right? Do you change your eating habits or do you wait? If you wait until your doctor tells you between bites to change, it could be too late. In fact, even after the Surgeon General's report came out, medical community still dragged their feet. The AMA actually went on record refusing to endorse the Surgeon General's report. Why? Could have been because they were just handed a $10 million check from the tobacco industry? Maybe. Okay, so we know why the AMA may have been sucking up to the tobacco industry, but wait a second, why weren't more individual doctors speaking out? Well, there were a few gallant souls ahead of their time speaking up against industries killing millions, but why not more? Maybe it's because the majority of physicians themselves smoke cigarettes. Just like the majority of physicians today continue to eat foods that are contributing to our epidemics of dietary disease. What was the AMA's rallying cry back then? Everything in moderation, right? Extensive scientific studies have proven smoking in moderation. Oh, that's fine. Sound familiar? Today, the food industry uses the same tobacco industry tactics, twisting the science, misinformation. Right? The same scientists for hire paid to downplay the risks of cigarettes and toxic chemicals are the same paid for by the National Confectioners Association to downplay the risks of candy, and the same paid for by the meat industry to downplay the risks of meat. But consumption of animal products and processed foods contributing to at least 14 million deaths around the world each year. So for those of you involved in this evidence-based nutrition revolution, hopefully to have a new endowed position soon, we're talking about 14 million lives in the balance. These days, plant-based diets can be considered kind of the nutritional equivalent of stopping smoking. But how many people have to die before the CDC says, don't wait for open heart surgery, before starting to eat healthy as well? Until the system changes, we need to take personal responsibility for our own health, for our family's health, for our patients' health, for our community's health. We can't wait until society catches up to the science, because it's a matter of life and death. Dr. Kim Williams, who actually spoke here as one of the 13, he became president of the American College of Cardiology a few years back. In an interview, he was asked why he himself follows the same diet he recommends to all his patients, a strictly plant-based diet. "I don't mind dying," Dr. Williams replied. "I just don't want it to be my own fault." Thank you so much, everybody.
Thank you so much, Dr. Greger. That was fabulous. I'm sure that there are lots of questions and comments from the crowd, and I invite you to line up at the microphones to share questions for Dr. Greger to respond to. We have plenty of time for that.
Good evening, Dr. Greger. Thank you so much. I've been following you on YouTube for quite some time. I have one question for you. I follow a lot of other plant-based doctors, i.e. Michael Clapper and Joel Furman, and both of them are saying that vegans should be taking DHA and EPA's algae-based supplements, and I think even Dr. Furman quoted the Advent 2 study saying that we need to start doing this. I'd like your opinion on that.
Sure. There are, first, I will absolutely answer your question. First, there's one supplement critically important for anyone eating a healthy diet. You need a regular, reliable source of vitamin B12, which you can get from fortified foods or from supplements. There's only 2 vitamins not made by plants. One is vitamin D, made by animals such as ourselves when we walk outside. And the other one is vitamin D, not made by animals, but made by little microbes that blanket the earth. So we used to get B12 drinking out of a mountain stream or well water or something, but now we chlorinate the water supply to kill off any bacteria. So we don't get a lot of B12 in our water anymore. Don't get a lot of cholera either. It's a good thing that we have a nice sanitary system. But due to that, we need to get a source of B12 from somewhere. Our fellow great apes get all the B12 they need eating bugs, dirt, and feces. I prefer supplements. 2,000 micrograms of cyanocobalamin, which is the most shelf-stable form, once a week. Costs $5 a year, all the B12 you need, critically important, and regardless of what you eat, at age 50, the National Academy of Sciences said everyone should be supplementing their diet with vitamin B12 since we get our ability to extract B12 from food declines with age, but at all ages, critically important for anyone eating a plant-based diet. Okay. And then vitamin D depends on your sun exposure, if you're stuck inside all day or whatever, you may need to supplement your diet. You see that a lot of institutionalized elders receive really low levels of vitamin D. And so the only other for the general population, some people who are pregnant or homeless or in prison, or there's lots of special situations in which special nutrient supplementation is recommended. But alcoholics, but bariatric surgery patients, blah, blah, blah. But in general, the only other supplement beyond potential for cholesterol-lowering supplements, it's a whole other conversation. But the only other supplement of the general population I would encourage people to consider is a pollutant-free source of DHA. So National Academy of Sciences recommend 250 milligrams of DHA, this long-chain omega-3 fat, which our bodies can actually make DHA from short-chain omega-3s and flax seeds and walnuts and stuff. The question is, can it make enough for optimal health, particularly cognitive health, particularly for older men, because women have the ability to make an entire brain into their bodies, which is about 1/3 dry weight, pure DHA, so they have to produce a lot of it. Men not as well. This is not for your heart health. This is for cognitive health. And so I think it's a reasonable recommendation to make. So you can get algae-based DHA, which is where the fish get it from. These are essential fats. Fish don't make it, we don't make it, but they get it from the bottom of the food supply, and these golden algae that make it. So 250 milligrams of algae-based DHA every day is something to consider. And if you're on the fence, then I encourage you to watch my video series on the subject and make up your own mind, your body, your choice. But vitamin B12 is non-negotiable, critically important for anyone eating a plant-based diet. Next question.
Hi, my name is Dina. I am a nurse practitioner and starting a functional medicine practice next month.
Nice.
So I have a couple questions, but one, I started my career in the era of when somebody was diagnosed with diabetes, they sent a home health nurse to the home to mitigate that, educate to reverse that disease process. And now I worked for a big insurance company for many years, and these, managing these chronic condition patients, and they don't have glucometers. They don't know what their blood sugar is. They have no idea and have never been told, supposedly, what any of these things mean. So I'm wondering, how do we make this change? How do we educate or, have health systems empowering providers to address these things? I understand there's time issues. I understand there's, follow the money type of issues, but it's almost criminal that somebody diagnosed with a disease has not had a conversation with the provider of how to reverse that disease process.
Yeah, no, thank you so much for that question. So at all levels of even just particularly within the medical profession, right, we need to be teaching medical students. We need to be testing medical students on the boards. Otherwise, medical schools might not even teach nutrition. It needs to be in postgraduate medical training all throughout the system. They play a critical role in about 80% of what primary care doctors see, which is these chronic lifestyle diseases. And then, of course, so there's issues with time. There's issues with reimbursement. Doctors may not be able to, get paid for telling people how to take better care of themselves. Now, with diabetes is the exception. The doctors can not only get paid for counseling type 2 diabetics on diet and lifestyle, but can be paid for group visits. So you get 10 of your type 2 diabetics together in a room or over Zoom, and you can actually get paid for that kind of education as well. So there certainly are ways, and I would encourage anyone who's interested in practicing lifestyle medicine, if there's any medical students here, to go to the American College of Lifestyle Medicine Conference next month. It's in Dallas. You get thousands of people go. It's amazing. And they talk a lot about these really kind of bread and butter issues. I guess I shouldn't say that. Some bread and peanut butter issues, a little better. You know, when they talk about reimbursement and, you know, how to kind of fit this within the system to practice this kind of medicine that makes your patients get better. I mean, that's really what, I mean, when you go to these conferences and you sit down and talk to people, it's like, you know, and you ask, like, how did you find out about this? Like, obviously, you weren't taught about this in medical school, right? You know, the number one thing you hear from practitioners, fellow practitioners, is it was a patient, right? All of a sudden, a patient comes back to you, and they look great. Their numbers are better, like all sorts of, you know, and you're like, oh, my God, I've got like 2,000 patients in exactly your situation. What did you do? And they say, oh, I saw this great documentary called The Game Changers, or I went to a great website, or I read a great book, or whatever it was, or What the Health. It's a wonderful documentary on Netflix, right? Randomizing identical twins to eat a plant-based diet or not, and what happens. Oh, my God. Okay, and then, so the patient is the one educating the doctor, and the doctor's like, oh my God, and checks it out, and then, and I think can reignite the spark, the idealistic spark of why we all went into medicine in the first place, right? If you wanted to make money, you go work on the stock market or something, right? People go into medicine because they care about people, they want to take care of sick people, yet it's very frustrating to practice primary care these days because our patients get worse, and they die, right? We can slow down the rate at which our diabetics go on dialysis or lose their vision or, you know, but people don't get better, right? The lifestyle medicine, because these are lifestyle diseases, you can get that like lay on hands, jump out of the wheelchair kind of, that's why we want to make people better, right? This is exciting. And so, I mean, it's the kind of conference you go to where it's like doctors are happy. Happy doctors. What a concept. So check it out if you're interested. Yes. Oh, sorry. Let's go over here. I didn't even, all right, great.
Dr. Greger, I'm so happy to have you here. Much like you, my father had very progressive heart disease, died at 61. We did not have answers back in 1991 when he died. I, at that point, was sent to go get tested. 99 pounds, cholesterol of 340.
Oh.
Familial hyperlipidemia.
Yeah.
My PCP could not talk to me about diet. I, in fact, bought your book and brought your book to her. I, in fact, had a cardiologist, spoke to him about diet, and he told me he likes to enjoy his food. Thankfully, I was married to a physician who discovered you.
Oh, nice.
We both started to read your book. I started to cook your food. And thankfully, I'm where I need to be at. I changed my cardiologist to Geisinger, and they sent me to a cholesterol specialist, a nurse practitioner, who has been absolutely wonderful. Where do we find these physicians for preventive medicine?
We got to make them.
We need them.
We need great institutions to make them.
It took
I
me
know.
20 years.
Yeah. Your cardiologist wants to enjoy their food. You want to enjoy your life. And they're not, as hopefully we'll find out tonight, they're not mutually exclusive. You can have fantastic food and enjoy a long, healthy life.
I'm just looking for a source.
In terms of sources, so there's, so it depends where you live. Obviously, you need to talk to someone in this area. Down where I am, more in the kind of DC area, there's a Barnard Medical Clinic. Lifestyle Medicine Clinic. They do amazing work. And so there are some resources online. So you go to ACLM, and people who signed up to be like certified in lifestyle medicine. There's a board of lifestyle medicine now. And so you can get a sense. It doesn't mean that they're good doctors, or but at least they at least they're in the same, talking the same language, in the same universe. And so that can be started. But really, it's like talking to your neighbors, that's a good doctor in this area, and it's that word of mouth. It's unfortunate. Like, you think these days there'd be a way to just but yeah, it's really, it's just like, you just find a doctor you love and don't let them retire ever, and hold on to them, and right?
Hello, Dr. Greger. My name is Michael Weinberg, and I want to tell you first, thank you for coming here, and thank you for what you've done in terms of education. Personally, I've been on a plant-based diet for 7 years, and personally, it has reversed my own diabetes. So,
Woo!
the focus tonight is about the subject of chronic pain, and chronic pain is something which affects many of us, and I believe that a plant-based diet can positively affect people who have chronic pain, but I think moderation is not going to do the job. I think only a strict plant-based diet might be effective. Can you comment on that?
That is I didn't pay him to say that's the topic of my next book, How Not to Hurt, which will be out in December 2026, if I make the deadline, which is questionable at this point. And so I'm going to be talking about what we do for the tens of millions of people suffering in chronic pain, for which the medical community has not had great, answers to historically. And there's really remarkable studies like this famous diabetic neuropathy study that took people with painful diabetic neuropathy, which is a very frustrating condition to treat because there's not much we have for it. Put people on a strictly plant-based diet, and within 11 days, the majority had no pain at all. Like, absolutely remarkable. And then until they went back to their old diets and their pain came back. And so we have studies like that, and these are small studies, but it's just like, what's the downside of eating healthier, right? I mean, that's and this was before their blood sugars even got better, so it wasn't because their blood sugar control improved. I think it's actually, so they took the nerve biopsies, and I think it's like, the current thinking was that it's actually kind of ischemic changes, a lack of blood flow to the nerves themselves, these little arteries that go in the nerve sheaths, and that basically the nerves are kind of screaming out in pain because they're lacking oxygen, and that just eating a diet that dilates the blood vessels has significant improvement in artery function, not even structure yet. Remember that remarkable slide I showed of this nuclear scan where there's blood flow to the heart within 3 weeks of eating plant-based, fully blossomed out? They weren't reversing their atherosclerosis in that time. They were just able to dilate their arteries better because they're eating healthier. And so we think that's what was happening with diabetic neuropathy. But there's lots of really interesting studies in that realm where it's just like, why haven't you heard of that study? That study was done back in the 70s. Why haven't we heard about this? Well, because there's no corporate budget driving its promotion. Right? I asked the medical students at lunch today, I asked, when's the last time they were taken out to dinner by Big Broccoli? Not a single person was able to answer that question.
Back in 2016, I did attend Dr. Caldwell Elston's lecture.
Great.
And one of the questions in the audience was, where do we find reliable information? Where do we find a reliable source? I didn't have the courage to scream out because it was silence. nutritionfacts.org. So here we are.
That was very sweet.
And by the way, after attending 5-year lectures, I did donate. Okay. I am on your side. I've been a vegetarian nearly my whole life, and 98% plant-based.
Good.
But I asked this question: how do you rebut, with research, the carnivore diet? Okay.
Okay. Well, yeah. It's like asking. How do you rebut the flat Earth theory, right? I mean, the carnivore diet is like the flat earthers of the nutrition world. But unlike flat earthers, I mean, flat Earth theory isn't going to kill anybody. But, anti-vaxxers or people that are telling people to eat all meat diets, their misunderstanding could actually hurt people, could kill people. And so, look, you want to go online and spout crazy, talk about lizard people. Okay, but when that goes from lizard people to now fry your fries in beef tallow, and this is coming from Director of Health and Human Services, what is going on? So I wanted to do a video on the carnivore diet, this internet phenomenon, but there's no science. So I was like, let's look at all the studies in the carnivore diet. There aren't any because no nutrition scientist in the world would I don't know. Yeah. In fact, there are studies where they want to see if, giving people, red meat consumption is what it's doing to fecal genotoxicity, which is like the DNA damaging effects of like your stool, because that's coating the lining of your colon. And so they gave people 2 servings of red meat a week, and they see if they, and you say 2 servings a week, are we actually going to be able to get some signal out of that? But they explained it would be unethical because it's a known human carcinogen. They would consider it unethical to feed people red meat more than two servings a week because, we hurt people here. We're doctors. It's like, what do you say? So it's just, here's what you say. You say, so Dr. David Katz, he's the head of Yale's Prevention Research Center. He had the exact same frustration you have, which is, this wild, wild west of the internet, people saying all sorts of crazy stuff. And how do you know how do you differentiate fact from fiction, right? They each have science, pseudoscience, whatever. How can you tell, right? They all have studies, whatever. Okay. So he was so frustrated with this, he started what he called the True Health Initiative, which is a nonprofit organization. He's like, look, you want to know about climate science? You go to the IPCC. You go to you ask the climate scientists. People who spent their entire lives studying it. Well, what do they say about the climate? Okay, so he got together about 500 of the top nutrition researchers in the world to agree to a consensus statement on what is the healthiest diet for human beings to counter all the kind of craziness on the internet. Okay, let's just ask what the experts say. So you can go to truehealthinitiative.org to see what it is. Spoiler alert, it's a diet centered around whole plant foods, right? It's like the core tenets of healthy eating and healthy living. There's a consensus, scientific consensus going back decades. And so, the most uncontroversial statement in all of nutrition is eat more fruits and vegetables. So a diet that says don't eat any fruits and vegetables, it's it doesn't even pass kind of the sniff test before even going further. But anyway.
Okay. Thank you.
Yeah.
So just in case there's somebody here who's a diabetic who's on insulin and wants to be off of it in 2 weeks, could you give us a little more concrete advice about how they would do that?
Okay, yeah, I'm so glad you asked that. So for someone who is on blood pressure lowering medications or blood sugar lowering medications, it's critically important that you make any dietary changes in conjunction with your prescribing medical practitioner, because they need to rapidly deprescribe, wean you off these drugs, because you can't be on multiple blood pressure lowering drugs with normal blood pressures. You'll crack your skull open. You can't be, so you go to these lifestyle medicine conferences, everyone will tell you, I put someone on a healthy diet and got woken up in the middle of the night because my patient's drenched in sweat because their blood sugars are through the floor, because it works too well and faster than people realize. And so within days, you could be dangerously over-medicated. And certain medications more than others. There's certain medications you take out first with these hypoglycemia risks. Same thing with blood pressure medications. And so you have to do this with it because, ironically, they can work too. Healthy diet and lifestyle changes can work so well, it can actually be dangerous if you're on some of these medications. And so it's critically important to do it in conjunction. And so ACLM, the American College of Lifestyle Medicine, actually has a prescribing guide for physicians for type 2 diabetes. This is exactly what they do. If they're on these medications, with these sugars, on this diet, this is first we put them on a healthy diet, okay, and then we cut insulin in half, and we do this, and we do this with Valente insulin, and we keep them on metformin, and blah blah blah, and then every day you can track and follow the protocol. So there are now clinical practice guidelines on how to do this, because we weren't taught this in medical school, and it's critically important to be able to pull people off these medications, if necessary. Forget who's next. Yes.
Hi, good evening. My name is Dipti Pancholi. I'm an internist. I have two statements and a question.
Please.
So when I graduated medical school in the 1990s, I had 3 hours of nutrition education in 2 years. The second statement I want to share is a story. I work at the Veterans Administration Hospital. And 5 years ago, a patient came to me and said, I want you to check my blood work every 3 months. He had diabetes, chronic kidney disease, hypertension. And he went on a plant-based diet, and his chronic kidney disease reversed from stage 3 to stage 1. I saw it in front of my eyes.
Yep.
And then my question is, what do you say to those people who say you don't get enough protein in a plant-based diet?
Great question. So thank you so much for those comments and the question. So you actually got slightly less than the national average. The latest national survey of medical schools found 4 hours of nutrition training out of thousands of hours of preclinical instruction. So I went to the medical school with the most nutrition training of any school in the country, Tufts, because they have an adjoining school of nutrition, 21 hours. That's the most that any doctor got. Again, out of thousands of hours of preclinical instruction. And of course, most of those hours are like Krebs cycle, biochemistry of vitamins, scurvy, beriberi, things, not chronic disease treatment, which is what, of course, we really needed. And one doesn't have to rely on anecdotes about kidney failure reversal. There are systematic reviews, because there's so many reviews and meta-analyses of studies of plant-based diets specifically for reversing chronic kidney failure. You can randomize people to the exact same amount of plant protein versus animal protein, see significant differences in what's happening with their kidneys, and the difference is actually obviated with injection of a powerful anti-inflammatory drug. So this thing, it's the pro-inflammatory effects of animal protein on the kidneys that's causing this kind of redlining of kidney function. But in terms of your question, where do you get protein? Anyone who doesn't know how to get protein on a plant-based diet doesn't know beans. Legumes, beans, split peas, chickpeas, and lentils. These are the plant protein superstars. These are the healthiest sources of protein, because the least of which is because of food is a package deal, right? As much as Burger King says you can have it your way, you can't be like, yeah, okay, I want the protein, I want the iron. Okay, hold the saturated fat, hold the trans fats, hold the hormones, blah 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 blah. Right? No, it all comes together, right? If instead, you got your iron from, dark green leafy vegetables or something, the baggage that comes with that iron, oh my God, it's the fiber and the folate and the potassium and all the things, the nutrients of concern that people aren't getting enough of, the antioxidants, blah, blah, blah. And so, food is a package deal. We should think of the whole protein package, in which case, oh my God, legumes are the healthiest source of protein, most concentrated source of fiber in the legume community. Of all the 150 nutrients tracked by the USDA in the American diet, the single greatest nutrient deficiency is not protein, fiber. So 97% of Americans don't reach the recommended minimum fiber. So 97% of Americans eat fiber deficient diets. And ironically, it's actually exactly reversed for protein. So 97% of Americans get enough protein, reach the RDA for protein, only 3% don't. Presumably those are people who are just not eating enough calories, period, not eating enough food. But so it's really like, where do you get your fiber from? Oh my God, geez, I can only, yeah. Anyway, yes.
Well, I have a question. I saw that you had a slide up there with some other medical conditions, and you may want to stay away from those. But I was curious if you know of any studies of the plant-based diet and how that impacts ALS.
There are no studies on plant-based diets. It's never been tested. In fact, I don't think there's even any case reports of plant-based diets for ALS. The one thing I had, my mother-in-law recently died from ALS, and in researching what was out there for her, it looks like there's decent evidence for high-dose B12 injections. Like, these are absolutely massive super physiological doses, like 5 milligrams of vitamin B12 injected in a specific schedule, does seem to basically prolong the illness. So it slows the rate of decline. There was no reversal, but it really, you can randomize people, and you can inject yourself at home. And so, I mean, we started our injections. I don't know if it helped at all, but I was disappointed to see that there was, first, so little research into the condition, and there's so little we have to offer, either from kind of the conventional medical standpoint or, going elsewhere.
So since you're familiar with it, I'd like to also ask, there's a high caloric intake that you want to maintain. How do you do that in a plant-based diet without eating all day long or eating a lot of fat?
No. In fact, that's, people can lose, the caloric, the low calorie density of plant-based foods is wonderful if you're trying to lose weight, which most people are in this country. But if you're trying to maintain your weight, you have to make sure you have to go out of your way of eating calorically dense plant foods. So that's the nuts, seeds, nut butters, seed butters, avocados, dried fruit, so like trail mix kind of stuff. And of course, you can throw this stuff in a smoothie. But yeah, you really have to put some thinking into including, so it's like, almond butter and everything kind of thing.
Yeah, okay, thank you.
We'll wrap up with just these last two questions briefly. And,
the pressure's on. These better be good.
Then we have good news about dinner, so don't leave after the two questions.
Oh, all right.
Hello, doctor. So, thank you for your time here, but I'm going to be quite honest. I do enjoy meat quite a fair bit, but about a little over a year ago, I moved in with my girlfriend and her family. They were primarily plant-based diet as well, and and also changing career. Walking 7 miles a day now at least. Yep.
Great.
And a concern used to be making sure my pants weren't too tight. Since converting more to a plant-based diet, I have lost 20 pounds, and I now have to worry about my pants not falling off.
Hey. Good problem to have.
Yeah. And for those who do enjoy meat more, like, my folks, my dad's about to turn 60.
Yeah.
He's a little bit on the larger side. He does have a high blood pressure. How would you what are good steps to convert people to more like a
great
plant-based
question.
diet? Especially because in those cultures you mentioned, in Africa and Asia, they're not fully plant-based either. They do have,
No,
meat,
absolutely. Right.
meat celebrations, for special events.
Totally. Yeah. Okay. First of all, look, meat's delicious, right? Donuts are delicious, right? Heroin, I hear, feels fantastic. Fantastic. But, that's what we have a brain for. We make rational decisions. We're responsible for the predictable consequences of our actions. And thankfully, we have this tremendous leverage over our health, destiny, and longevity that the vast majority of premature death and disability is preventable with a healthy enough diet and lifestyle. How do we get that across to people? So first of all, it doesn't matter what you eat on your birthday, holidays, special occasions. It's the day-to-day stuff that adds up. We cannot let the perfect be the enemy of the good. Absolutely. It's all about, and look, you remember that, even going down to a semi-vegetarian, significantly lower levels of diabetes and high blood pressure, right? And so, the Sunday roast instead of, the center of the plate every single day, right? And so absolutely quantity matters. And in terms of kind of interpersonally, how to reach people is instead of coming from a kind of holier than thou preachy kind of standpoint, which is not, it's hard not to do, but come from the reason I'm telling you this is because I love you. It's like the reason I want you to eat healthier is because I want you around for longer, right? And if they see that's really coming from this caring standpoint, right? Then I think it's easier for people to kind of take in that message, right? And they know the moment you start slipping some bacon on their plate, they're like, oh, wait a second, right? No, but it comes from a place of love. And I think that's the most important thing. And then look, it's their body, their choice. If they want to go smoke cigarettes or bungee jump or, not wear their seatbelts or disconnect their smoke alarms or whatever, like, look, what can we do? But we can, we can love them regardless, and we can be role models of healthy eating, and we can, push some broccoli towards them.
Hi. So me and my fiance here are raising our daughter. She's 9 years old. She's like a plant-based diet.
Boom!
We're at least trying our best to, but we're receiving a lot of backlash from family members on her biological father's side. So I am wondering if there's anything like health-wise that you can give us insight about on like what to say to them if anything were to arise.
Oh, well, I mean, anything could arise, you go to the doctor and find out what's going on. I mean, critically important, obviously. But you can help, you can be like, you can get, the 7th edition of Child and Baby Care by Dr. Benjamin Spock, the most well-known pediatrician in human history. It was the last edition he wrote before he died in his 90s, in which he recommended all children be raised with no meat, no dairy. I mean, it's like, oh, well, if the most esteemed pediatrician of all time says it. And then you go to the American Dietetic Association, which has a position statement that, that not only is even strictly plant-based diets appropriate for all stages of the lifestyle, of the lifespan, but specifically offers health advantages, right? We have an epidemic of childhood obesity, and I mean, oh my God. I mean, they should be like breaking down your door to be like, I want my kids to be healthy as your kid. Yeah, anyway, great.
Join me in thanking Dr. Greger. Long ago, when this series was started, those who originated the idea thought it very important to celebrate post-lecture with a plant-based meal, to give everyone an experience of that, especially for those that might wonder about ways to find fulfillment in such a treat. And tonight, I'm pleased to say that each of you is welcome to join us for a plant-based dinner hosted by Maximum Zen. And the way that we're going to navigate that with this many people in the crowd is invite you to please find a seat in the lobby, and then you will be sent to the buffet line by tables once a table is seated. Therefore, we will not end up all in the same buffet line waiting continually to be served. So I'm sure that Dr. Greger will be hanging around for a few minutes here and welcome further engagement. Those of you who are eager to eat, find a seat at a table, and Kara will gladly get you set in the buffet line. And thank you again for attending.
Oh, I'm so glad you came. Very great.
Thank you.
Yeah, that was fun.